Hi, I'm Dr. Paul Lin from Taiwan. I graduated from Ohio State University in 1991. I then became a clinical assistant professor from 1991 to 92. I returned back to Taiwan to practice for almost 20 years right now. My practice was limited to perio and implantology. I have a training center started 4 years ago, providing the training for periodontics, implant and aesthetic and laser dentistry. I've been involved in academic activities mostly in Asia. We have in the past established good relationship with Japanese Academy of Clinical Periodontology, I was able to really have good communication and obtaining the treatment concept pretty much similar from the aspect of an Asian, trying to look at the aspect of keeping the natural teeth periodontally is pretty much what I perceive somewhat different from the Western world. Now, people from my society demand more teeth that can be kept if possible. As long as they're functioning, they would like to have it saved or kept for a longer period of time. So then we will provide more periodontal service than implant service, which is fine. And as far as the aesthetic is concerned, there's increasing demand for patients who now request for a better enhancement of their aesthetics right now. That was compared to the Western, was somewhat behind, but is catching up. For the world that I now currently teaching 1 week per month in mainland China, I realized that it's about maybe 10 years behind what our practice is, but they are catching up very quickly. They are aspiring all the information from current dentistry, and then they will love to spend their time and effort to try to catch up in a timely fashion right now. Yes, well, I didn't have much implant training before I graduated, but I was able to utilize the surgical principle as well as the non-surgical principle to master implant dentistry a few years after I graduate. I think implant is certainly good and coming to help for the reduced periodontium, which then replaced some hopeless teeth and was able to provide additional help for those questionable teeth, that in the end we can have a survival of those questionable to guarded teeth for a longer period of time. And my concept is that I utilize implant to replace missing teeth in the first place, like what Ian Lindy said. But then my way of practice is to see what patient demand. In the posterior region, I would tend to replace with implant more often than the anterior region, because I think the natural dentition has a better way to keep the natural aesthetics. And I was able to utilize some of the grafting procedure to keep the teeth longer periodontally. As always has been my main thing in lecture, is trying to provide maximum preservation of the anterior dentition for aesthetics and to provide optimal reconstruction for the posterior, primarily for function. Because I don't think there's any teeth that is hotter than anything else that has to be removed right away. I can always try to ease off the problem of the teeth by periodontal treatment or endodontic treatment for the anterior teeth, and then to really avoid the embarrassment of removing any part of the anterior dentition without providing any better provisionals. And then with the same agreement of the patient, we would always try to restore the posterior occlusion for function, and then at the end we will come back to the aesthetic region to see if there any further improvement we can provide for the patient. So then the maximum preservation for anterior aesthetics and optimal reconstruction for posterior occlusion and function is what I'm been focusing on. Well, it's easier to sell to try to maintain it, the dentition that was reduced or diseased in the Eastern world because of the cultural differences. However, there's more people that is now influenced by a trendy concept that the periodontal disease dentition is not going to last long, and implant is certainly a better solution. Now, in struggling between different parties, I only provide what I think is best for patient. Now, if patients choose to have something they think is going to be what they like, long-lasting, I only have one question for them, that implant, when diseased, may be more difficult to maintain. I just wanted to let them know that, because I have problem treating some diseased implant dentition that I have more hard time to trying to control or to provide a better future service. So then I would have the patient to think about this as a balance. Okay. Now I heard an idea which is very alarming to me, is that people were saying that periodontal disease is an indication for extraction and replacement with implants. That really scares me, because I was trained as a periodontist, although that I utilize implant at the same time. I always think that natural dentition can be survived for a longer period of time than what we think right now. Before knowing how to treat, maybe we should be able to look back in the past to how people can be maintained for a longer period of time utilizing certain type of periodontal therapy. Now, I still think that there's a position for periodontal therapy to help current dentition. And implant is coming to play with a paradigm shift to help the existing dentition, not to replace them. So that's my way of concept. If there's a people that was thinking otherwise, I will be more than happy to exchange my way of thinking. My master's thesis is involved in laser treatment for periodontal disease. Although I don't find it very valuable at this point to treat periodontal disease with laser. However, I utilize laser for aesthetics as well as for periimplantitis. Now, the surface that was contaminated is no longer useful using hand and instrument or scaling or root planing, but now can be only achievable in sterilization or decontamination by chemical or optical, which means laser. Now, I have been utilizing Urban laser for the past few years. I found it very useful in controlling the periodontal disease around implant, and but not by non-surgical procedure, but rather by surgical procedure. And all those corrections with soft tissue and hard tissue as well, I always utilize laser to decontaminate the root surface. As far as the technique that I think has a future application is the utilization of emdogan and growth factor, and nowadays BMP. I haven't been able to use BMP because it's not available in our society. However, I think that in the future, when applied, it can make grafting, bone grafting, and maybe even soft tissue grafting a lot easier and user-friendly as well. I think that's an advancement that I'm looking into in the future. I used to be a very sporty man, but I haven't been. I enjoy playing golf, playing tennis and badminton, and I also enjoy listening to music, watching movie, and currently I develop an interest, well, sort of following Sasha, appreciation of arts, and I would like to collect the arts from some promising artists.
For more education programs, visit the Guide Institute at www.guidedental.com.